one of the biggest issues we've been dealing with COVID right now is schools, because schools in New York City, for example, were just closed again because of the spikes we're seeing all over the country, including in New York City. And joining us on the phone to discuss is Randy Weingarten. She is the president of the American Federation of Teachers. Good morning, Randy.
Hey, how are you?
You know, I feel like every day I wake up, I'm grateful that I'm awake and everything is okay in my household. But I am extremely concerned about the short-term and long-term future for everybody, just for everybody. How are you holding up?
So, I feel the same, I feel the same way. I feel like there's been, this has been, like the New York City school situation is a big setback. And I was concerned that one more time people look at schools as an island as opposed to thinking about what we need to do as a country and as a city to, drive those numbers down again. I think that there's a lot of, well, if only, it's not going to be a problem if only I go out to a bar and, not wear a mask, or if I have a big wedding as, 10,000 hot seats did, or if, and you understand everyone's fatigue with this, and then the realization that, places like New Zealand and, Australia have not only gotten this under control, but kept it under control because there was a trust that that the public health aspects here were a patriotic duty to do, as opposed to, that there was a fight between, freedom to, and public health. And so, thankfully, and I think this week is going to be a big week for all of us. I think this week, with all the certifications that come due, it will be clear to everyone, including the president's party, that Joe Biden will be inaugurated on January 20th, and that there's, and that we'll have a new president who will help be more transparent, help pull people together to actually do what we need to do public health-wise to now plateau the virus. And help deal with a vaccine as fairly and as appropriately as possible. But I'm not giving up on the second semester of this year, and we're doing. We've spent all weekend long kind of putting together what we think is like the 10 things that we need to do for schools, school buildings, not just for schools, but for school buildings to be reopened in the spring, because we as a union are going to do everything we can to get school buildings, not just schools, but school buildings reopened in the spring, knowing full well that it's absolutely imperative for kids to have some in-school instruction, particularly for younger kids and kids with special needs.
Right. And I feel like, as we've gone through this, once in a lifetime, once in a generation crisis, it feels like some of the steps we've been taking, and I think we've talked about this before, they feel backwards. So at the beginning of the pandemic, when schools first closed, that was like a major moment. It was something that seemed like, okay, that makes sense. You don't want to have, if they're telling us, you can't have a whole bunch of people together, schools are one place where people congregate, and young children, we didn't really know anything at the time about asymptomatic spread, or, we didn't know as much as we know now, and that children may, be carriers of the virus, and we didn't understand all of the facets of that and how it was transmitted. In hindsight, though, the more that we are learning, and especially it's because we're watching what's happening in other countries where they close bars and restaurants, but schools are open, is that children, sometimes they do carry it, and obviously there are some children who can have bad symptoms and condition and inflammatory syndrome post-COVID diagnosis. But that actually, it's the restaurants and the bars that are the problem. It's not the schools that are really the huge factor in many of these spikes. So do you feel, so I guess my question is, like, are we doing this backwards?
Yes, of course, and we've been doing this backwards from the beginning. I mean, you know, I've been on your show, so let me just, as I understand the science, and now, you know, because you've got this quack who is the head of so let's put it this way. Now the word science has been used to mislead, as opposed to having a group of scientists led by Dr. Fauci and others who would actually give an unmistakable, constant message to Americans about what the science is. What we've learned from New York City's experience with reopening school buildings, and New York is the only large school system to do it, and I'm really proud of the educators in New York who were willing to suspend their own fears if we got the science and the safeguards right to be able to do this and to reopen schools in September and October. And that's part of the reason that we know this research is that schools in themselves, if you do the protections, the safeguards that the CDC require or that recommend, and that only through collective bargaining will we able to insist on, the masks, the physical distancing, the electrostatic cleaning, ventilation, and constant hand washing, that schools are not super spreader. You know, schools themselves, particularly for young kids, elementary school kids, are not super spreader events. That's really great news. And that you're seeing in Europe as well. That's the best news that we've seen. And we know that because of all the testing that Mogu and others insisted. The places that are super spreader events are bars and restaurants, indoor dining and indoor drinking, and congregate activities. So yes, we should actually be trying to reduce community, you know, we should be actually trying to deal with bars and restaurants and other congregate activity. This is the issue, that the United States didn't do a stimulus, unlike Europe and other places. So every time that a bar closes, then the question becomes, what happens with the people who are working there? What happens to the business? And so what Trump and Mnuchin and McConnell did by refusing to negotiate a stimulus is they pit the issues of health and safety of people against the issues of their economic viability.
Right. And it feels to me also like, speaking of it, how it's backwards, what if the people who work in the bar or restaurant have kids? I don't understand where the kids were supposed to go. If schools were closed, but the bars and restaurants were open, and the people that work there have children who need to go. I mean, I feel like it feels like the policymakers didn't consider, you know, that people that work may have school-age children that need to go to school.
But I think that's a child care issue all over the place. And look, the real dilemma is that, like, when you say that, like, think about September and October. Like, it was a massive effort in March to stand up hospitals, to do the kinds of things in New York that needs to be done. There should have been we're now 8-10 months into this. There should have been a massive campaign to fix ventilation systems, like what was just announced in, Philly in the last week or two. There should have been a massive campaign to fix ventilation systems. like what was just announced in, Philly in the last week or two. There should have been a massive campaign to hire more teachers so you could have teachers who were doing remote education and teachers who were doing in-person education. There should have been a massive effort to find more space so that you could have more, more kids going to school in person, because I think that, and none of that happened. So it's not simply the issue of that bars and restaurants were more of a priority than schools. The issue is that that the prioritization of schooling didn't happen, and what happened instead? It kind of got defaulted to teachers and to districts to okay, attaboy, do the best you can, which is what people have tried to do. But we've had a lot of experience. As I count it, most of the school districts represented by our locals were opened in September and October using using the kind of push that we made for the safeguards. And so what you're seeing is high school kids, just like college kids, are not as disciplined as elementary school kids, and you're seeing more of a spread if you look at the New York City numbers in terms of high school kids than elementary school kids. But so I hope that we can get this spread under control. I hope that there can be more of the kind of targeted closing and opening instead of done by the whole city, like Andrew Cuomo had been doing with these red and orange and yellow zones, and the same, and see the same in other places, and so that they'll try a regional approach. But what's happening now is at one point or another, it's not the 3% number. It's that Montana has a 50-some-odd% number. 40, that it's just this virus is now completely out of control in so many places that there has to be an effort to get the spread plateaued, because you're starting to see hospitals being totally, you don't have any hospital space left. You're seeing death numbers double as well. So we're unfortunately getting back into a March situation as opposed to in terms of a July situation. But I think if we really focus on how are we going to reopen school buildings, tackling the curve, having the safeguards, having a Department of Education as well as a COVID task force, putting them out over and over again, just like you used to see all these public service announcements about staying home and washing your hands.
Right.
There needs to be the public service announcements with all the masks, with the physical distancing, and a real process for getting the vaccines out. And then we have to actually really think about how to actually help kids make up for this time, like the opening up school cafeterias to feed families, to address nutritional issues, having community schools and wraparound services, so we have nurses and guidance counselors to address lots of, the emotional impacts of this virus, having more hotspots for kids to have, the kind of connectivity that they need, as well as more availability for internet, having a big push for tutoring that's connected to, curriculum that's done by teachers, thinking about a very broad and robust summer program, voluntary summer program. So we really find different ways to address the instructional needs and the social well-being needs that kids have.
Yeah, it feels to me like there's so many needs, right? I mean, I think what this has revealed, the pandemic itself, is all of the ways in which we were coming up short in a lot of areas systemically, and I think, the funding clearly in the bill that Mitch McConnell will not pass, it will go to many of the things we're talking about on the state level, right? The states need that money. localities need that money to implement many of the things you're talking about. And it feels to me like there's a disconnect between the people who are making the policy and what their priorities are, right? They keep talking about the economy, but they're not talking about schools. And I feel like schools need to be first, because you can't reopen businesses if the parents don't have anywhere to send their children. They're not, and many parents are going to make the decision not to send their children into a school, even if it's open, if it's not, if they're not given all of the information, as you laid out, as to how that school is safe for their kids. So it's important for us to be really transparent about what we're doing to make sure the kids are safe. But as we've seen in Europe, if you do it following the science, you actually are able to keep the schools open. And that is going to be something we're going to pay attention to. We are out of time in the segment, Randy, unfortunately, but we would love to have you back so we can continue talking about this topic, because I don't think it's going anywhere, because it's clear we haven't figured it out yet. So it might take us a little while longer, but hopefully not much, because we do have a new president coming January 20th. Biden-Harris will be sworn in.
Right. Let me just say one more thing, which is that teachers want to be back in school. They want it to be safe. We need to have the reasonable accommodations for those who are at risk and their families at risk. But everybody understands that it's much better to have, some kids in school for some period of time so that you can create that connection. I fear that unless we have a lot more buildings and a lot more teachers, we're not going to get all kids back at all times, but we'll be able to have some kids back like New York City did.
Right. Absolutely. Randy Weingarten, thank you so much, President of the American Federation of Teachers. And we'll keep an eye on this story, because obviously, not on this story, this is our lives. We'll keep an eye on this aspect of COVID and our response.